welcome to everyone to tonight's forum titled Higher Costs, Corruption, Ontario's Private Clinic Fiasco. My name is Michelle Robidou. I'm one of the co-chairs of the Greater Toronto Health Coalition, and we're gathering today virtually from different areas of Ontario and beyond. And I'm myself located on the traditional lands of the Huron-Wendat, the Anishinaabe, the Haudenosaunee, and the Treaty 13 lands of the Mississaugas of the Credit. We honor and recognize the First Peoples of this territory and the ongoing contributions of First Nations, Inuit, and Métis people to the vibrancy of our communities today. And I'm grateful to have the opportunity to meet and live on this territory. We acknowledge and denounce the colonialism that continues to shape our healthcare system today. Just a few weeks ago, a CBC investigation found that procedures at the Don Mills Surgical Unit, which is a private clinic, are paid for by the government at double or triple the cost of procedures performed in public hospitals. These findings on the CBC piece are the tip of the iceberg of the lack of accountability, the higher costs, the corruption, and the profiteering, frankly, that the Ford government is unleashing at the moment with Bill 60, which is now a law. We then found out after the CBC report that former Health Minister Christine Elliott gave this private clinic, Don Mills Surgical Unit, a 278% funding increase while she was minister, and that she's now a lobbyist for the clinic's parent company, Clearpoint Health Network. So there is much to discuss tonight, and we have an excellent panel to lead us through some of the key issues we're confronting with Ford's all-out assault on public health care, and specifically on public hospital services, which is our focus tonight. The panel will also talk about not just what is going wrong, but what we can do about it. And so tonight's event is co-organized by the Ontario Health Coalition and the Greater Toronto Health Coalition, and is being co-sponsored by the Brampton-Caledon Health Coalition, Durham Health Coalition, Grey Bruce Health Coalition, Halton Health Coalition, Hamilton Health Coalition, London Health Coalition, Mississauga Health Coalition, Niagara Health Coalition, North Bay Health Coalition, Ottawa Health Coalition, Oxford Coalition for Social Justice, Peterborough Health Coalition, Port Dover Health Coalition, Renfrew County Health Coalition, Simcoe County Health Coalition, and Waterloo Health Coalition. And the reason we want to really underline this, it's been a very intense year of organizing to stop Ford's plans to privatize our hospitals. And these local coalitions are ground zero in this fight in the localities. So if you volunteered in the referendum last May, organized by the Ontario Health Coalition, or if you joined a rally or protest, or if you attended a meeting, I'd invite you to raise your hand in the raise hand function or just on the screen in the old-fashioned way to give us a sense of how many people have been part of this. And we want to, we want to salute all of that work, all of that effort, all of you who are coming out tonight. And also, this is fantastic. Amazing, amazing. Beautiful. This is, I think, incredibly important going forward because we are definitely in a fight of our lives. And so we want to salute that work that's been done. And for those of you who are coming out for the first time, we welcome your involvement. So I would just invite you to check out ontariohealthcoalition.ca, and there is a tab on there that says local coalitions. Find your local group, and by the end of tonight, hopefully you'll be inspired, if you haven't already done so, to join this work. So our speakers tonight are Andrew Longhurst, who's a research associate with the Canadian Centre for Policy Alternatives. He's the author of the recently published report called At What Cost? Ontario Hospital Privatization and the Threat to Healthcare. Our other speakers, Pam Parks is a registered practical nurse and the co-chair of the Durham Health Coalition. Kevin Scarrett is from the Ottawa Health Coalition, and he's been doing research into the question of the private clinics in the Ottawa area, and he'll speak to us about that. And Natalie Mera is, of course, the executive director of the Ontario Health Coalition. So those four speakers tonight are going to speak for about 7 minutes after each, not all totaled, after which we'll have time for question and discussion. And our panelists will come back at the end to respond to comments and questions. And as you would have noticed at the beginning of the meeting, there is translation tonight into Mandarin, and we're very thankful to Shulan Tian for organizing this outreach and for the Chinese Canadian Health Coalition for the work that they're doing. There's also closed captioning, and the meeting is being recorded. So just as housekeeping, so people know, you will be able to, when we come to the question and comment period, you can raise your hand or type in comments in the chat, so we'll be able to participate in that way. And so without further ado, I'd like to invite Andrew Longhurst to start us off today. So Andrew, you have the floor.
Thank you so much, Michelle, and thanks for the invitation to be with you this evening. What I'll do is provide, in the time that I have, an overview of the report that was released only several weeks ago, and look forward to a conversation this evening. So what this report does is it draws on freedom of information requests, financial and statistical analysis, and a review of the research literature and policy experience with for-profit delivery of surgical and diagnostic services. And ultimately, this report scrutinizes the Ontario government's claim that expanding for-profit surgical and diagnostic delivery will reduce wait times and increase capacity. And it looks at the implications of expanding for-profit involvement in Ontario. As you'll recall, in August of last year, the Ontario government announced that it would increase the number of publicly funded surgeries and diagnostic procedures performed in for-profit facilities. And then in January of 2023, the province announced a phased approach to expand for-profit delivery by outsourcing more cataract surgeries, as well as MRI and CT scans, colonoscopy, and endoscopy procedures in these private for-profit facilities. Then, in May of this year, the government passed new legislation to encourage the growth of this for-profit sector. Bill 60, as it's known, established a new framework for for-profit facilities. And these facilities have been called independent health facilities since the 1990s in Ontario. Ontario also has 2 private hospitals that have been grandfathered in, and the research also looks at the role of those. As Michelle mentioned, one of those is Don Mills Surgical Unit. So what makes the Ontario government's policy direction especially puzzling and troubling is that by Canadian standards, Ontario actually performs very well in terms of wait times for priority procedures. And this is in large part because it has not allowed a for-profit surgical sector to destabilize public hospital staffing, where the vast majority of surgeries are performed. Ontario has consistently performed better than the Canadian average for hip and knee replacement since 2010, and in recent years has maintained the shortest wait times for MRI and CT scans. In Ontario, publicly funded hip and knee replacements, or what we would call OHIP covered hip and knee replacements, are so far only performed in public hospitals, and MRI and CT scans are overwhelmingly performed in public hospitals. And yet these are the areas where the Ontario government is looking to privatize and move those procedures out of public hospitals. It's important to note that when we look at the evidence, Ontario outperforms BC, Alberta, Saskatchewan, and Quebec, and these are provinces that have had much more involvement from for-profit facilities. Now, I want to be clear. We know that wait times remain too long for too many patients in Ontario, But the sensible approach is to properly fund and improve the public system, not to destabilize it. What the report also does is provides analysis of public funding for surgeries and diagnostic imaging performed in for-profit facilities over a 5-year period, from 2017, 2018 to 2021, 2022. And this type of research has not been conducted in Ontario before. In as of January of this year, there were 902 independent health facilities operating in the province, and diagnostic imaging represents the overwhelming majority of services that they provide. We have 10 independent health facilities in Ontario that provide publicly funded surgical procedures. And as I mentioned, 2 private hospitals that perform OHIP-covered surgeries, Shouldice and Don Mills Surgical Unit. And I think the important point here is that in Ontario, the province has not embarked on the privatization of surgeries in the way that other provinces in the country have. And that really is important because there is an opportunity for the Ontario government to shift its policy direction before it goes down this road. And as we see in those other provinces with greater for-profit delivery of surgeries, those are provinces that do not perform as well as Ontario. So the research also looks at what information obtained from Freedom of Information tells us. And here's what we know from that analysis. The volume of publicly funded surgical procedures as well as medical imaging performed in independent health facilities has remained relatively stable in recent years, but this is anticipated to increase as the government outsources many more procedures. In 2021, 2022, less than 2% of publicly funded surgeries were performed in for-profit facilities. And this is quite different from other provinces like Alberta, where many more procedures are performed in for-profit facilities. In that same year, the for-profit surgical and medical imaging industry was a $500 million industry. And this is significant because what we see when we look at the movement in this direction is that the majority of public funding is going for medical imaging. But again, the concern is that as the province moves on increasing for-profit delivery, we are likely to see a for-profit surgical delivery. The concern is that this will continue to have a destabilizing effect on public hospitals and the short-staffed public hospitals that are already struggling to increase surgical volumes. What we also see from information obtained from Freedom of Information is payments to Shouldice Hospital and Don Mills Surgical Unit increased by 19% and 278% respectively over those 5 years. And I know others, Natalie, will talk about this significant growth in public payments going to Don Mills Surgical Unit. And these increases come at a time when public operating room surgical volumes remained below pre-pandemic levels. And what this tells us is that provincial funding and staffing shortages continue to challenge hospitals despite the government's plans to increase surgical activity in these very for-profit facilities. Now, the Freedom of Information request also uncovered a troubling finding that public payments to for-profit facilities cannot be accurately and completely accounted for in Ontario's public accounts. In 2021-2022, the Ontario government underreported payments to for-profit facilities by 720%. So this is a significant underreporting of the existing dollars that are already flowing to these facilities. And finally, what the report also looks at is what the evidence in Canada and internationally tells us actually reduces wait times over the long term. And what we see when we have provincial governments like Alberta that has been moving in this direction for some time, we see that private for-profit delivery of surgeries destabilizes hospital staffing. And this is because the same workforce can't be in two places at once. So when we look at the experience in Alberta, a recent research that was just conducted, we actually saw that as surgical volumes and public dollars going to for-profit facilities increased, surgical volumes in public hospitals declined, and overall, the province actually delivered fewer surgeries under this for-profit surgical initiative. So this is a cautionary tale and a big warning sign for Ontario. There are a number of other problems with for-profit delivery. We know that it costs more. We have evidence from BC, Quebec, England, and now recently Ontario, where we know that the same for-profit surgeries delivered in the for-profit sector were upwards of 2 times more expensive than those same procedures delivered on a not-for-profit basis in public hospitals. So it is a bad deal for taxpayers and the public. And we also know that there are risks to increasing the likelihood of mortality and poor outcomes related to for-profit delivery of surgical services and other healthcare services. So ultimately, and I encourage folks to check out the full research report. I think it was posted in the chat. I don't unfortunately have time to go through all of the findings, but what we see is as for-profit involvement expands, it comes at the expense of public hospitals and the province's ability to improve timely access to care. Contrary to what the Ontario government is saying about the involvement of for-profit facilities reducing wait times, the evidence from other provinces and internationally shows that it actually contributes to staffing shortages in the public hospital system, which lead to longer wait times overall. It also comes at greater cost. So the sensible approach based on the research evidence, based on the policy experience in this country and internationally, is to focus on public system improvements and start, first of all, in Ontario by making full use of the 34% of hospitals that have unused operating room capacity, and then from there, extending and expanding operating rooms into evenings and weekends. The issue in Ontario is that the workforce is in short supply, and that's the constraint. Simply building more for-profit owned facilities by investors isn't going to address the fundamental problem and challenge that Ontario faces. So I'll conclude there and look forward to the discussion. Thank you.
Thanks very much, Andrew. That's fantastic. And I appreciate that you had to condense a lot of the information that's in the report, and a number of people have asked in the chat for a copy of that or the link to that. And I think it's just been posted, but it is at the Canadian Centre for Policy Alternatives website as well. And it is called At What Cost? Ontario Hospital Privatization and the Threat to Healthcare. So with that, I'd like to invite our next speaker, Pam Parks, who is co-chair of the Durham Health Coalition and who is a registered practical nurse and an all-around fantastic activist. So please welcome Pam.
Yes, hello. Good evening, everyone. Thanks for joining us today. And I just want to thank the Health Coalition for inviting me here tonight to speak. As you heard, I'm a registered practical. I've been a nurse since 1986. Worked at Oshawa Hospital since 89, and currently in the image department for the last 12 years. But I'm also the president of our QP local at the Lake Ridge site. So on the ground realities, I speak about the privatization. I want to give you a glimpse of an under-resourced and understaffed ER department looks like in a public hospital, chronically deprived of funding. As you probably know, there are two main challenges facing our public hospitals, which are understaffing and limited capacity. Our ER is typically overflowing with patients who are forced to wait for hours before they receive care. Ambulances are lined up outside the ER because there's no rooms for patients inside the hospital. Sometimes it takes 5 to 6 hours or more for an ambulance to release a patient. And when these patients are eventually brought in and assessed by a nurse and doctor, they could be lying on a stretcher in a hallway or in a chair, some places in a storage room because there's no beds for them to rest on. So the wait continues. Sometimes we have to treat patients in the hallway, most of the time, especially in an emergent setting. But the employers get in very crafty because they see that the public is recognizing what's been hallway medicine. So they take the patients and bring them up to the floors only to house them in the hall of the public field. Now imagine a patient with mobility issues on a stretched hospital hallway where they have no real privacy as they are merely shielded by screens. And think of the feel when they are relieving themselves in a bedpan or a commode because there's no toilet available for them because they are not in a room. The sound of their bodily functions clear to people around them. This is dehumanizing as an assault on their dignity. And yet this is the norm in our hospitals. And the bad news is it's getting worse. Remember when Doug Ford campaigned in 2018 and promised he'll eliminate hallway healthcare in a year? Well, 5 years later, it's 22%. Every single day, we have at least 1,300 patients on average being treated in a hallway on chairs, wherever you can find room because of the lack of capacity. Meanwhile, the staffing crisis is only getting worse. And why wouldn't it? Think about all the hospital workers who are trying to the best to provide appropriate care, dignified care to your loved ones, every single patient. And yet we fail every single day as our caregivers, no matter how hard we try, no matter how many breaks we miss or lunches we skip, no matter how much we guilt ourselves into working overtime. There is never enough PSWs, nurses, clerks, dietary staff, housekeeping, and just enough, not enough staff. Workers are burnt out physically, mentally, emotionally. That's why turnover in hospital is close to 12%. That's why vacancy rates have tripled since 2015. Workers are losing faith in the system, in their workplace, in the employer. It's a broken system and a government that's not listening. Privatization is not the solution. The Ford government solution to this crisis is privatization. But how will that address these problems? Privatization is a fake solution. The main problem we see in our hospitals are related to understaffing and lack of capacity. Private clinics do not create staff. Instead, they poach workers away from the public system. Nor do private clinics add capacity in any meaningful way. Because for every bed you add to the system, you need staff to staff it. This is why over the past 2 years, we have had hundreds of ER closures across Ontario and yes, at the Oshawa Emerge. And also at the Bowmanville site, they also, over the summer, closed ICU. Can you believe that? ERs are shutting down because of short staffing. So while the capacity crisis is related to lack of infrastructure, and we need to open up more hospitals and beds without addressing the staffing challenges, that's meaningless. So what is Doug Ford doing to address the staffing in public hospitals? Well, look at the latest budget estimate for 23-24. Funding for hospitals is going up by a mere 0.5%, accounting for inflation. That is a cut. Imagine a big funding cut in the midst of an unprecedented crisis. It means hospital won't have money to hire more staff to provide quality care. It means skimping on all kinds of expenses needed at the hospital. While funding for public hospital is going up by less than 1%, guess how much private for-profit clinics are getting? Wait, listen to this one. 212% increase. How much of that money is going into profit? Well, good luck finding that out because their accounts are not accessible to us, the public. Meanwhile, hospitals are spending millions of dollars on private agencies. Agencies charge hospitals 4 times the cost of employing in charge premium to pad their profit, and staff that are working side by side are not being monetary paid properly by working beside the same agency staff. The expansion of nursing agency is also destroying workplace morale. Workers employed by agency could be made. What are you making as a hospital employee? These workers also have more flexibility in their schedules and can afford to work less. It creates an unfair two-tier system. This is another form of privatization that is hurting our public system. Public hospital needs investment. So what is the real solution? We need investment in our system. When Ford got elected, he said he would listen to frontline workers. Well, if he really listened to frontline workers, Mr. Ford would know that we're calling for more funding in our hospitals. We would know that we want more staff to ease our workload. We're asking for more capacity, and we want tools and equipment to deliver quality patient care. If Ford listened to frontline workers, we would know that we are committed to our patients, and we would prefer to continue working in healthcare rather than leaving the sector, that we simply want decent working conditions and fair compensation. He would know that healthcare workers don't want privatization. He would know that instead of wasting public funds expanding private clinics, he should be prioritizing improving public health, working with unions and other stakeholders to improve the lives of our citizens and our loved one that enters into a hospital system. In closing, we know that difference between rhetoric and reality. Ford and the conservatives are closing and diminishing our local public. They're privatizing and deregulating the healthcare workforce. They are privatizing long-term care for the next 30 years, privatizing home care, and much more. They are also building the infrastructure for private for-profit hospitals, and it's up to us all to defend our public system because we deserve better. Loved ones deserve better. Thank you for listening.
Thanks a million, Pam. That was really, really important to hear the frontline view on what it looks like in Ford's disastrous attacks on healthcare. And so that leads well into the discussion that we're going to hear from Kevin Scarrett, who's with the Ottawa Health Coalition, who's going to talk about some of the research that they've been doing on the private clinics, the situation of the private clinics in the Ottawa area. So please, Kevin, you have the floor.
Thank you, Michelle, and thank you, everyone, for the invitation to me and Ottawa Health Coalition colleagues to join this important webinar and meeting. It's a real honor to be alongside people like Pam Parks and Andrew and Natalie and everybody involved. I send my solidarity to everyone that's connected tonight across the province, in particular, fighting for to defend and protect our public healthcare system. I am here in Ottawa from unceded and unsurrendered Algonquin and Anishinaabe territory. And as indicated, I have a few things I want to share. If you just indulge me, I did prepare a couple of slides that I am hoping I will be able to see. Just give me one quick second to turn those slides on. And I should be able to get there. I'll need to share screen. There we go. Can people see the screen now?
Yes.
There. Yes, people can see that. Thank you. So the key, the points that I want to share is really the sort of the bad news from Ottawa is that Ottawa appears to be serving as sort of ground zero for a major problem in the emergence of private for-profit healthcare clinics, and in particular in this world of primary healthcare, not just the private clinics that we're sort of familiar with offering services that are not insured, but they're now moving in a new direction that's really deeply troubling. I know Natalie in Ontario Health Coalition has been talking about this. I can report from the front line here in Ottawa of what we're seeing. And I'll try to do this quickly because I know I don't have much time. But really the central update that I think people in other cities will be interested in is about this South Keys Health Center clinic that is new. We understood that it was newly established in October as a walk-in clinic. Turns out, after digging into it, we found out that the center was actually opened in March, but then it was sort of relaunched in late September, early October as a walk-in clinic, which featured a primary care services that were to be provided by nurse practitioners. And this generated some really important critical scrutiny, and it got into the media, which is how we sort of got connected to it, because an individual patient desperate for a family doctor saw this new sign for a walk-in clinic in the south end of Ottawa where there's a particular shortage. I should say, just as a tangent, Ottawa is also the front line of a massive shortage of family doctors. I know this is a problem everywhere, but it is a particularly dire problem. There are tens of thousands of people in Ottawa desperate to get a family doctor. So as you can imagine, this is a big deal. This sign goes up saying walk-in clinic, get prescriptions here. And then when people went in, what they found is that this South Keys Health Clinic is saying, yes, we're going to be able to provide you with primary care, but you have to pay a $400 per year fee to become a member of this clinic and get access to this service. So a very substantial punitive level of charge that, of course, we know many people simply can't afford, but those that can afford it will be able to do this. I'll just say quickly, I agree fully with Natalie, and I think the Ontario Health Coalition. This is a violation of the, we believe, letter and spirit, definitely the spirit of the Canada Health Act, and I would argue the Commitment to the Future of Medicare Act in Ontario. I will leave it to Natalie to talk about the specifics of the legal argument there. But one way or the other, it is a terrible development in the emergence of new forms of two-tier healthcare. I'll just say quickly, this clinic is offering a range of familiar non-insured services. Physio, sorry, that slide is supposed to say physio, chiropractic, occupational therapy, psychological therapy, and so forth. But it has also announced the establishment of an office of a GP, of a family doctor in the clinic, although they claim not formally affiliated with the clinic. So ostensibly separate, but we learned through the media that the clinic is offering that doctor that's located there free rent, which I think is very troubling, suggests something very dodgy happening. Also, this South Keys clinic, after we dug into it in a little more detail, we discovered that their website and the roster of medical professionals that they promote it includes a number of people. Well, it was actually exposed by the media that there was at least 2 of the individuals listed are not even like were fake. They were actually operating at other clinics, and their identities and biographies had been listed without their consent or even their knowledge.
2 minutes.
Other problems with this clinic, other people that are advertising appears to be with their consent, but they're actually working and operating in other cities. So I think they've padded their roster. They've made it, look like they have more and they're offering more than they really are. Now, fortunately, just to quickly move ahead, there was extensive media coverage and scrutiny of this clinic, including the $400 per year membership fee. And some of the media, fortunately, came to us, Ottawa Health Coalition, and we were featured speaking, condemning this, raising the alarm, challenging the legality of this fee, talking about violations of legislation, and calling on the provincial government, the Ministry of Health, to investigate this clinic. Fortunately, that scrutiny actually led to the minister at least claiming that she has directed her staff in the ministry to conduct some kind of investigation. I'm not really sure what that means, but we have ourselves contacted the Ministry of Health to try to pursue this and bring pressure to bear. I'll just say quickly, in terms of the digging and the research we've done, it turns out the ownership of this clinic is very secretive. There is a connection to a second clinic, and the 2 clinics together and the owners and managers appear to be a pair of individuals. Now, get this, their background was previously they were both involved in operating 2 different used car dealerships. That's what they were doing before they opened first one clinic called Neuromotion, and then this second South Keys clinic. I say that not to disparage people who have used car dealerships, but to say, like, what I've learned about this is there really is very little regulation or requirements on people who run private health clinics, and now clinics that are moving into vital primary care, and some of them clearly moving into it for the wrong reasons, to make money, and that's it. We've actually connected with several former employees of both of the 2 clinics, South Keys and this other Neuromotion clinic, and some of the former employees are telling us some very disturbing stories about the management, the ownership, and how they're operating. So that's the South Keys problem. I'm guessing am I down to my last minute?
Yes. Just a minute.
1 minute. I'll just say quickly, this is my last slide. That's the South Keys problem. In Ottawa, it's not the only problem. We have other clinics emerging that have actually pursued the same strategy. They're offering for a fee access to nurse practitioners. Like I'll just say in a nutshell, we have a nurse practitioner problem in the sense that these private operators are seeing an opportunity. Hey, we can abuse this access to nurse practitioners who have the ability to prescribe medication and perform other primary care measures, and we can charge whatever we want. There was a letter to the editor saying at an Apple Tree clinic, they've introduced a fee for renewal from nurse practitioners, renewal of prescriptions, $49 per renewal for those under 50. Get this, $97 per renewal if you are over 50, like explicitly age discriminatory. There's other clinics. I've listed them here in the slides. We can talk about it afterwards. There's a Good Doctors clinic. There's this other one I just discovered. It's really a major problem that we will be monitoring and updating you all on. And I'm very keen to be part of this discussion and how we build our movement to challenge this particular direction of the privatization of healthcare. And I'll stop there.
Fantastic. Thank you so much, Kevin. And you packed a lot in those few slides, and it's incredibly important to get these details, because no matter where we are in the province, we're all facing the same rolling out of these really despicable policies. And so I guess that brings us to our final speaker for tonight, Natalie Mera. I'm sure everyone here knows Natalie, the Executive Director of the Ontario Health Coalition, and really the driving force for the movement that has been fighting tooth and nail to stop this assault on our public health care. And so, Natalie, you have the floor.
Thank you. Hi, everyone. Thank you so much to the other speakers tonight. So interesting and alarming. And to all of the 320 plus people who are here. That's amazing. Yay. So very quickly, I'm just going to run through some info that I think is kind of key. The first is that I wanted to tell you about a patient. This is a recent story, and it's a case study that we're going to be releasing in a report in the next few days about private clinics violating the Canada Health Act. So this patient needed cataract surgery, and they opted to go to one of the large chains that do cataract surgery. He was informed that the surgery would cost, get this, $2,440 for if he did it with a laser, or $2,190 keratome, plus a COVID charge of $10. The clinic later tried to persuade him to buy eye drops to use after the surgery for $50, but he had found the same eye drops at Loblaws for $13.39 and told them no. They then told him that his first checkup was free, but any following checkup would cost $75 per visit. He balked, and the surgeon then advised him to go to Sunnybrook, where the surgeon worked, and the checkup would be free. Next, the clinic offered a free enhancement plan that covered any medical errors during the surgery. Normally, a corrective surgery would cost $1,200, but with their enhancement plan, their free enhancement plan, he would pay either $150 for free, quote unquote, enhancement corrective surgery that covered 1 year, $200 to cover 3 years, or $250 for 5 years. He understood, from his understanding, it was an insurance plan in case there's an error during the surgery. He was then offered discounts and new prices. He got it down to $1,740 for laser surgery and $1,690 if he chose keratome. And after a lot of heckling, he was then called to be informed that his laser surgery would now be free, but the eye drops would now cost $60. Then he received an invoice of $1,400 after the surgery, which ultimately he got down to $0. If this sounds dodgy to you, that's because it really is dodgy, but that is what is happening right now in the private cataract surgery clinics. Ontario doesn't have private hip and knee surgery clinics as a rule. We haven't privatized most of the surgeries. What we do have are these private cataract surgery clinics, and we can see from their behavior what the expansion of private clinics would mean in Ontario. So let me just be clear. The Canada Health Act says that you cannot be subject to extra billing that is charged, your surgery charged to OHIP, and then you charged on top of that. Nor can you be charged user fees, that is, you cannot be charged for your surgery or your diagnostic test. All medically necessary hospital and physician services are covered. That's what we won when we won public Medicare. So these clinics, including this particular chain that is telling people that the chain is not covered under OHIP, that is not true. Cataract surgery is a medically necessary surgery. It is covered under OHIP. All of the tests and procedures associated with your surgery are covered under OHIP, including the eye measurements. All of the eye drops and ointments that are required as part of your surgery and your diagnosis are covered. You cannot be charged $100 for eye drops and all of these other things that are now routine in the private for-profit cataract surgery clinics. And it's not like they're not making enough money off of the public healthcare system. The private clinics are being paid more than $100 more per surgery than public hospitals are to do the same cataract surgeries. In addition, they are extra billing the patients, and they're charging for a whole array of add-ons. In Andy's report, Andrew Longhurst's report that he was telling you about, he dug up that the province had actually, under the Ford government, since they got elected in 2018, so the fiscal year runs from from April 1st through to March 31st of each year. So in that fiscal year that they got elected, 2017-18 to 2021-22, to last year, they Don Mills Surgical, which is one of the only 2 remaining private hospitals, for-profit hospitals that we have in Ontario, received a 278% funding increase. 278%. And then subsequently, CBC Michael Crawley at the Queen's Park Bureau of the CBC found that they were being paid significantly more per surgery. So, for example, for cataract surgery, public hospitals were being paid $508. Don Mills Surgical was getting $1,264, is getting, I should say. For knee arthroscopy, public hospital, $1,692. Don Mills Surgical, though, $4,037. So more than double the cost for each surgery that they do. And despite these significantly higher costs, the province actually increased their funding by almost 300% since they took office. And then all of that happened while Christine Elliott was the health minister. And then she didn't run again in the 2022 election. And just a little while ago, registered to become a lobbyist for that same for-profit hospital. We held a press conference a couple of weeks ago about this because under the Private Hospitals Act in Ontario, private hospitals are banned. The act was amended in 1971. It took effect, this part took effect fully by 1973. OHIP was brought in 1972, by the way. And so what the act says is that you cannot open any more private for-profit hospitals in Ontario. They're banned, right? So no more. It also tries to prevent any government from getting around the ban by expanding the existing private for-profit hospitals. So you can't expand the number of beds in a private for-profit hospital, and you can't expand the number of patients in a private for-profit hospital. So it would be unlawful, therefore, for the Ford government to have vastly expanded this private for-profit hospital. Furthermore, under the Members Integrity Act in Ontario, cabinet ministers are never allowed to go and become a lobbyist for a company regarding a decision for which they were fundamentally involved in their cabinet position. So Christine Elliott was the health minister. Her law firm claims that she was not involved in the decision to increase Don Mills Surgical's funding by 278%. That's a pretty hard thing to believe, frankly, given that there's only 2 private hospitals that are doing surgeries. It would always be a political hot potato, and that any expansion or renovation of any private hospital requires the minister's express written approval before it can be done. So for all of those reasons, it's very unlikely that the minister had nothing to do with the decision to give a massive funding increase to Don Mills Surgical. Let me just ask you all, did your local hospital get a 278% funding increase since 2018 when the Ford government got elected? Not even remotely in the ballpark, not even 10 times less than that would they have gotten since the Ford government got elected. I mean, it's just not even in the scheme of anything else. It reeks. And we're digging into this, and we'll be doing more about it as we get information. We're going to do a Freedom of Information request to get the licenses, and we'll be trying to expose this. And this is not the first time that this has happened. I have no idea how long I have. Michelle?
You have 2 minutes left.
Okay. This isn't the first time that this happened. You may all remember long-term care. And I just wanted to show you a picture. This is because I think it matters to see this as a human. These are services, right, for people fundamentally. This is Patricia Crump. When this is early on, she was admitted to Orchard Villa. She died there during the pandemic. And her daughter, Diane Colangelo, described her. She was known for her wicked sense of humor. She made people laugh. She had a sunny disposition. She was a mother, a grandmother, a great-grandmother. She raised 5 children and survived the deaths of 2 of them and her husband, who died 25 years before her. She was a payroll administrator. She worked for 72 years of her life. When she was admitted to Orchard Villa, she weighed 108 pounds. Sorry, I'm trying to find it. And when she died, 114 pounds. When she died, I'm just going to forward a slide. This is Patricia Crump, just before her death, a couple weeks before her death. She was 68 pounds. When they finally took the people out of Orchard Villa, the residents out of, and it wasn't, by the way, the staff. I mean, she died holding the hands of a nurse. The staff who remained, there were only 20% of them left by this point, are angels. Diane, wept as she told the public about her mom's death. And she said they deserved so much better. This is a for-profit long-term care home owned by Southbridge, a chain which had the worst death rates in the pandemic. When they finally admitted the residents from Orchard Villa into Lake Ridge Hospital, they found that they were dehydrated, malnourished, they were anorexic, they were starving, the residents in that home. They paid for their care, and the taxpayers, as residents and taxpayers, we paid for it too, but they didn't get it. Southbridge actually is just an investment company and wasn't providing any care at all. They hired an Extendicare, another chain company, to do the care in their homes. And every month of the pandemic, those for-profit chains took their money out, but they didn't provide the care that they were paid to provide. It's the same thing as the for-profit clinics that break the law. They do what they do. They establish the facts on the ground, as in Preston Manning's words, when he was encouraging the privateers to just go ahead and do it. And then, challenge governments to stop them. They lobby against regulation. They lobby against fines and enforcement of legislation. It becomes almost impossible for the public to overcome the private lobby. They have all kinds of connections in government, and in some cases they are the government, as in, the long-term care industry is so close to this government, sometimes they're not even distinguishable, and they get what they want over the public interest. It is to our peril that we allow this government to expand private for-profit medicine. It is to our peril, and it will mean the death of single-tier public Medicare in this province and this country if we don't stop them. And I look forward to the discussion tonight about how we build our movement and strengthen it to stop them.
Thank you so much, Natalie. Thank you to all of our speakers for providing us with a fantastic springboard for a discussion tonight. And we welcome people's input and questions, comments. And so we'll just ask if you would like to make a comment. You can just raise your hand. And because everyone is muted, just to allow for the meeting to flow smoothly, we'll unmute you when you get called on. Unfortunately, it's hard for us to see because there are so many screens of how many people are here. It's preferable if you can use the raise hand function, which is at the bottom of your screen under reactions. It says raise hand. And as well, Alana will be going through some of the comments that have already come in and some of the questions in the chat so that we can ensure those are part of the feedback to the speakers as well. And after we've had a chance for a discussion and for questions, we'll bring our speakers back in turn to respond to some of those questions. And feel free to if you have a question to a specific speaker as well, please do that. That can be helpful. So I'm going to just look at the sorry, things are jumping around on my screen here. So we have I'm going to call on Anne Shattuck as our first speaker. So Anne, you have the floor, or hopefully you do.
Thank you. Thank you. One of the things we had a meeting with our MPP Peter Tobin on Friday, and he said the stories, get the stories, find the stories. And I'm wondering if even from tonight, we can ask everybody in their circle, in their hub, in their Facebook, I don't care, ask, has anybody been charged for, extra things like cataracts or anything else? Would you please tell me your story? And we just start there, collecting the stories, because that we can get into the media, and we want to keep ourselves there. That's it. Thanks.
Thanks very much, Anne. Next, Alexander Wang.
Good. Can you hear me?
Yes.
Okay, great. Thank you so much. First of all, thank you to all the speakers for the great information. I'm going to make a statement, and I don't want to have it come across as though I'm ungrateful for all this information, but my frustration is that I have heard a lot about the challenges and all of the issues that we face. I've been on numerous calls similar to this one. And I guess my frustration is that we seem to struggle, and I put it in the chat, we seem to struggle with how we message the challenges so that we are as successful as the people who were with the Green Belt, where they got the Ford government to stop and reverse his decision. And so I wish we could, form a work group, a working group, where we could come together, for those of us who are interested, in putting together some kind of a messaging platform that can go out, that we all speak from the same, from the same platform. I have spoken with senior people in my building, and I'll tell you, it seems to be a 50-50 split. Some people are saying, yeah, we have issues. And some people are saying, no, I think privatization works because it reduces the wait time. And it's so frustrating to hear that, because I've been involved with the Ontario Health Coalition, and I know all of the challenges and issues we face, but it's really challenging to articulate why that is. And I wish we could just do that. So that's my comment. Thank you.
Thanks very much. And it's a very fair point. And it's actually something that I think all of us in our local coalitions are struggling with, and constantly trying to review and refine. And so I'm sure others can address that as well from the floor. Next, Jim McDowell.
Hello, all. Back on last Tuesday, can everybody hear me?
Yes.
Back on last Tuesday, the Brampton Calvin Health Coalition had their town hall meeting, and it was shocking stories that we were hearing. But one of the most shocking stories came from Dave Wakely, who is the president of the Peel Paramedics Association. What he was saying was he was just notified, basically less than 4 days before that the Peel Paramedic Union, or Peel Paramedics, would actually be broken up into the 3 cities. The reason why this is happening is because they're dissolving Peel Region, and each city would basically be responsible for their own paramedic services. The reason why this is so shocking is because this would come into effect on January 2025. So basically just over a year for the cities to organize and implement their own paramedic services. The reason why it's so shocking was that many members of the paramedic services in Peel Region are looking at quitting their jobs in Peel Region and finding another position outside of Peel. There are over 1,000 openings for paramedics in Ontario. And the reason why this is shocking is because these paramedics have no idea if they're going to be employed in 2025. So there is a serious crisis which is coming onto the horizon in Peel Region, where we might have code zeros across the entire region on a daily basis. Code zero is 0 ability for ambulances to come to an incident. So this is what we're facing in Peel Region. But the most shocking part was what Dave was saying, was that this could come about as early as July of 2024. So we are facing a true crisis in paramedic services in Peel Region, and there was no true answer to this. So this is what was notified to us, but obviously with all the other situations that are happening with Peel Region, and especially with Brampton, because Brampton has a population now of over 850,000 people, and we have one fully functioning hospital. And we do have the old Peel Memorial Hospital, but that is still classified as an urgent care center. The services are only offered between 8 o'clock in the morning and 8 o'clock at night. So saying that, we are truly seeing the increasing of crisis of the healthcare crisis in the Peel Region. But there are also a lot of people who are theorizing that this is just the start, that the Ford government is using the privatization or potential privatization of the paramedic services in Peel Region as a model for the rest of the province. So this could cascade into a truly critical situation being played out across the entire province. Thank you. I'll leave it at that.
Thanks very much, Jim. And I'm going to call on Nancy, and then we'll go to some of the chat online, and I'll get Alana to give us some of the questions from there. So go ahead, Nancy. You're muted. Your microphone is not on. Sorry. Can someone unmute?
I've asked her to unmute. I'm not sure if she's been able to.
Nancy, can you see a message there that says to unmute? No. Well, perhaps maybe you could put the question in the chat while we figure out your microphone. And I'm just going to go right now to Alana. Maybe you could feed in some of the questions from the chat.
Yeah, we've had quite a few questions surrounding where the federal government is amidst all this privatization. And I know Natalie has been discussing with people in the chat. I thought maybe it would be nice to have this as a verbal conversation as well, just so we can all hear it and the Mandarin interpreter can also translate this for us.
So, okay, so should I jump to Shulan?
Yes, thank you. So everybody, because we have some Mandarin only participants in this room, so I'm just going to encourage our participants to speak up if they have any questions or comments. So I'm going to just speaking in Mandarin. 我们中文的朋友，如果你刚才听到现在为止，你有什么感想，或者你有什么问题，或者你有什么意见的话，也欢迎你打开麦克风之后用中文讲就好，我会帮您翻译。So, okay. Michelle, back to you.
Thank you very much, Shulan. So, Nancy, it looks like your mic is now operating. Can we test it out?
I think you are identifying me as Nancy because I lost the link for the meeting and she sent me hers.
Okay, I was going to say.
It's Nick Applin in Ottawa with the Ottawa Health Coalition. And one of the questions I've wondered about for a long time is whether we might get some purchase by drawing attention to the fact that Ontario has underfunded healthcare by $500 per capita for something like 30 years. Less than the average of all provinces and territories in Canada. And I'm not sure that we would get purchase, but if people realize that we've been underfunding our healthcare to that extent, it might help to push our provincial government to invest more.
Okay. Thank you very much, Nick. And I apologize. Wasn't too sure. Now,
Understandable.
are there any other things you want to share from the chat? I mean, all I can see is a steady flow of questions and comments, and I know there's just a ton of detail there. But there are some practical questions. Someone raised that they would like to see the slides that Kevin shared with us. So if that information is available in some kind of format that we could share, perhaps that's something we could send to attendees by email because you've all registered. Elena, is there anything else, or shall I move to our next person with their hand raised?
Yeah, we've got more questions. I think this one is for Pam. Someone earlier on, they asked, is the 5 to 6 hour offload reference to Lake Ridge hospitals or Ontario average?
Right. Okay, so let's move. Oh, is there another one?
Yeah, I was just wondering whether the speaker would answer directly, but I'll just keep going then. Let's see.
I can answer if you like.
Oh, okay.
Yeah, that's actually quite generous. If you ever been to the Lake Ridge lately, you're waiting even longer hours than the 5 to 6. So that's quite generous. So people have been there for like 10 or 12 hours. So, and that's not exaggerated. And it's a long wait time.
Thanks, Pam. All right, I'll move on to Malcolm then. Did we lose Malcolm?
I'm here. Thank you. I was unmuting myself. Thank you very much again for this excellent webinar, and thank you all the speakers. My questions, I guess, are directed to Natalie. My name is Malcolm Buchanan. I'm with the Congress of Union Retirees of Canada, and we've been fighting this privatization initiative, Bill 60, for some time. Just a couple of practical questions, Natalie. I think it's time that we launched, with your good wording, to get request to the Auditor General of Ontario to do a cost analysis of Bill 60 and its implications for public health care, similar to what we did for the Green Belt, if it can be worded correctly. But I think we can keep the government on the back foot if we can get get the Auditor General on the job. And the other one is one that you've alluded to regarding trying to enforce the lobbying regulations in Ontario. And I think it's time for the Integrity Commissioner to be involved in that, especially it relates to Christine Elliott. And it would appear to me that we should get the Integrity Commissioner to get an NDP or a Liberal or a Green MPP to initiate an investigation. And the third thing, very quickly, is under Schedule 1, I believe, of Bill 60, and I made this point when I made a presentation to the Queen's Park on this, who is now being assigned to be the sort of the Mandarin who's going to be in charge of granting these private for-profit clinics the go-ahead and so on and so forth. I haven't heard anything about who's doing that, what the rules are. Is it a private company? I know the person is meant to be, or the group is meant to be, the director is outside the role of not under the authority of the Ministry of Health. So I think that's another thing that we have to really get on top of. Thank you.
Wonderful. Thank you so much, Malcolm. We're going to go to Terry now. Go ahead, Terry.
Hi, hope you can hear me.
Yes.
So I think this is more towards Natalie. The picture that she showed was heartbreaking. I have a parent who has Alzheimer's. I'm gonna cry, I'm sorry. I've looked at long-term care. Long-term care can guarantee me 2 hours of one-on-one care. What did they do with the other 22 hours with my parent? I have a friend who, her mom walked into long-term care, walked in. Now she's wheelchair bound, and the doctors are telling her that death is imminent. And this poor lady, she's had to hire a PSW because nobody will look after her mother. And it's heartbreaking. It is absolutely heartbreaking. And so, you know what we have to do? We have to put a face to what we're doing, right? If we all share our story, if I'm not like Doug Ford, I can't afford to have somebody come in and take care of my parent. But I want Doug Ford to see the face that he's hurting. And if we all do that, right, as long as we remain faceless, we have no power. But if we have a face, we're going to have just a little bit more power. And I think as the election comes along next year, we have to remember and we have to ramp it up. Anyway, thank you so much.
Thank you very much for that, Terry. And it's good to hear these suggestions and these ideas. And we really need to pull some of these together at the end of this meeting so that we can leave with the sense of how we can start to chip away at this. I want to move it to Faylene now. If Faylene, go ahead.
Yeah, what you just said, Terry, was very moving. And sorry, and the last thing that Natalie, that you showed, that the picture of the woman in the long-term care facility. I think it is really true, sort of what Alexandra was talking about in terms of our messaging, to actually get across to people what it means right now and what it will mean in the future for healthcare in this province. Those kind of stories, we do need to get those out. I also think, in terms of what Alexander was saying about the victory, at least hopefully, I mean, I think we have to be vigilant about whether or not it will be a victory in the long term in terms of the Greenbelt. Someone in the chat talked about how the scope of the privatization of healthcare, what we're talking about is billions and billions of dollars for private for-profit companies. And that is, in some ways, is a much broader assault on us, on people. And it, at the beginning of the meeting, when Michelle asked, people to raise their hands, have you been involved in a meeting, in the referendum, in talking to neighbors? And almost everyone, I think, put up their hands. Really, that's what it takes. That's what it is going to take to stop the assault on healthcare. But I think, as Terry was saying, with our own stories, we have the powerful testimony, and so we do need to figure out how to get that out more broadly. And I want to thank all the speakers tonight, because certainly the information that we got, and I think those are going to lead to new ideas. Thanks a lot.
Thank you, Faylene. Next is Tana.
Hi, thank you so much. Perry, I lost my mom in August, and I spent 2023 navigating our Ontario healthcare system with my 86-year-old father. And it was eye-opening. A woman who was dealing with a particularly nasty form of cancer, and in a very uncomfortable place on her body. And we couldn't get nursing care sufficient to help them. And it ended up that I had to quit work I had to take a leave. Thankfully, I had a job where I could do that. but I had to take a leave in order to support my parents because yes, they could not afford to hire private care, which is what I kept being told. Oh, well, you could just hire a PSW. Well, I don't have money to hire a PSW. My parents don't have money to hire a PSW. And until I got into the system with my folks, I had no idea our system was in such peril. And it really is in peril. And one of the challenges that I see is a huge amount of waste in the system, not from people, not from the angels that are actually performing the work, because they truly are angels. We have privatized nursing where we're shipping product into people's homes so that patients can be taken care of at home. And it's thousands of dollars that are going into people's homes. And when they pass away, in my mom's case, after 9 days of a 3-month prognosis, after 9 days, that was garbage. Garbage. And it's unconscionable the amount of waste because she's only one patient. And it's happening all across the province. There's nothing wrong with this product. It could be going back somewhere. I get the whole process piece. I've been a process and an inventory person for years. I understand the challenges, but these are the kinds of things that as we privatize, there's no onus on these private companies to manage this, and the government isn't even thinking about this, I don't think. So I wondered what I was going to do in retirement, and I think after tonight, I may have found something to work on. Thank you.
Fantastic. That's excellent. Thank you, Tana, for that. Next is Ken.
Got it. Hello. Anyway, name is Ken Robertson from Simcoe County. I just would like to thank Natalie and everybody at the Ontario Health Coalition and all the other health coalitions that are doing excellent work with this here. And this is, although it's very informative, it's also very disturbing. The only suggestion I may have for individuals is the last few months, my wife and I have had to deal with our local member of provincial parliament. He's a conservative on other issues. And while we're dealing with him, we bring up the funding issues and the privatization of our healthcare. And what I found interesting from all my experience in the past few years of dealing with, especially conservatives, they seem to be a little bit different now. I think they're hearing from more and more people. And I think it's really important that we get out there, and although it can be frustrating, especially dealing with conservatives, is that they have to hear us personally, meet with them, phone them, set up meetings with them, and express our concerns and demand a follow-up. Anything at all to help. And again, I want to thank the Ontario Health Coalition for all their work. Natalie, you do a great job. Thank you.
Fantastic. Thank you very much. All right. So our next question from the floor is from Ginny. Go ahead, Ginny.
First of all, thank you, Natalie and Andrew and crew. Incredible report. I've read it a couple of times and I actually printed it out so I walk around with it. You know, Natalie, during the pandemic, that's when you really got my heart. And how you got it was you telling the stories with real people, right? And I felt like no one else was talking for people in long-term care, but Natalie Mara was out there, right? You were a face for those people who couldn't speak. So thank you. During the ombudsman's report, you know, when it came out, he used the words that, because I've got this real thing, no inspectors, right? There was no inspection at the beginning and people were left for dead. I mean, how can we as people in the province tolerate this? I mean, we can't and we shouldn't and we won't because it's inexcusable. So you know, I think those stories and the real people, you know, I think that a suggestion would be that the coalitions gather the stories and we feed them to the MPs, and then maybe they can present it to, I don't know, do they have time in the House where they can present these stories? Like, just keep it in front of people, because when people see real people, they feel their own vulnerability and they act. And so if you aren't near it, you don't think about it, you don't want to think about it, most people, right? But if those stories are just over and over and over, I don't know, I think the stories and the real people are the way to go. And yeah, I think we need to shame Mr. Ford out of office.
Excellent. Thank you, Ginny. I'll move it over to Alana for a last round of what's coming through the chat.
Yeah, so somebody has asked earlier on, are they charging fees as well as charging OHIP? Somebody has also asked an interesting question. Is thought being given to having someone who has paid one of those $400 extra fees to be recruited to serve as a test case litigant, to have this practice declared by a court to be contrary to the relevant legislation? We have more questions about where the federal government is amid all of this. Somebody has asked, where did the car dealers get the money to open the clinics? I believe in Ottawa. And else? Someone has also asked about private companies having to show their financials. They've asked if this has changed because it seems like they don't have to, unlike nonprofits. Pam, I believe somebody in the chat who asked about the offloading times would like to connect with you offline about that. So I think we can maybe discuss that later. And somebody's also asked, the government is cutting coverage of procedures and meds behind the scenes, and we don't know until we go to get access for care. And is there a way to lobby for any changes to be publicized regularly? And there's another comment, I think, just a little bit ago, somebody has mentioned that the doctors who are influencing government health policy should be careful lest they be found to have a conflict of interest. And I do see there are more comments coming in as we speak. Let's see. Yeah, people have mentioned contacting their MPPs, which is a very important thing. And yeah, social media outreach as well. There's been some discussion about that.
That's great. Thanks, Alana. And I see we have Alexander is going to come back. Go ahead, Alexander. Oh, you're muted.
I don't think he heard you, Michelle.
Oh, I see.
There we go.
Oh, okay.
Yeah, sorry about that. I said you can call me Alex. I have a habit of typing my full name in, so sorry about that. So I just wanted to say I am willing to put my money where my mouth is, and I am going to raise my hand and say that I will happily work with anyone who is on this call to work on the messaging aspect and see what we can do to put together a compelling message. I think, Ginny, when you were talking, I was thinking about my own sister who passed away in a long-term care home. And I think until it impacts you directly, you almost don't feel it. And you talked about COVID. And I remember during the COVID pandemic, we heard a lot about all the issues with long-term care. We haven't heard a lot since. It's just gone silent. And maybe it's time to resurrect some of those issues and challenges and pain that the lack of care is causing, and bring it to the forefront again, because it's maybe, unless I'm not hearing the news correctly, but I'm not hearing too much about issues in long-term care. So I'm willing to do what I can to help with the messaging. Thank you.
That's fantastic. And Alex, if you want to, if you're not connected with one of the local health coalitions as well, so you are, okay, great.
The Hamilton Coalition.
Fantastic. And so I think at this point, with all of those questions, thank you very much to everyone for your contributions. And I'd like to bring, I see one other hand. We'll take Joseph as the last question, and then we're going to hand it back to our speakers who can take a few minutes to respond to some of the discussion. So go ahead, Joseph, and you'll be the last question from the floor.
Thank you all. I would, in terms of consequences in long-term care and in, there were some instances where civil suits were brought forward, and I haven't heard anything in the news about civil suits against some of the long-term care homes being held to account for failures to provide the necessities of life, or maybe adhering to the standards of professional practice that they're required to implement. And Mr. Ford, when the report came out from the military that went into the long-term care homes to provide care to our seniors, I recall him distinctly saying that if there were failures where people did not provide the necessities of life, or they would be charged. I don't think anybody's been charged. And I know in the States, in the for-profit sector, if private institutions don't provide the care that they're required to, there's a lot of lawsuits. We got the carrot going on here of everybody talking about bringing things forward and putting it in the face of the public, but then there's also the stick of legal consequences to those that fail to do so and what they're obligated to do so in caring for others. In past webinars, I've mentioned if this happened to our children in schools or in a private sector, Family and Children's Services, the police would have been there lickety split. It would have been all over but when it happens to our vulnerable seniors, you don't see anything. I don't see police going in anywhere. So that's my 2 cents. I think not only the stories have to be brought forward to the politicians, maybe we need a professional law firm to stand up and take the violators and start holding them to account. Those that violate and don't provide the service that they're required to do so. That's my 2 cents. And thank you for your advocacy and caring for all of us that at the Ontario Health Coalition and all the provincial health coalitions that are bringing these concerns forward.
Well, thanks very much. And I do apologize for folks who have put up their hand, but because it's already 8:30 and we'd like to give all of our speakers a chance to come back. If you're able to put a question in the chat, we can also pass those on. But I'm going to ask our speakers to come back in the order that you originally spoke in. And so I'm going to call on Andrew to give us his response and his concluding remarks. So take it away, Andrew.
Great. Thanks for all of those great questions and comments. And I really appreciate hearing the discussion and the stories that people are telling. And I think it's really important to continue to tell these stories and be bringing visibility to these issues and the importance of public health care and what it means in people's lives. So I noted a few themes in some of the discussion, and one of them I think that was brought early on was when talking to people and having conversations about privatization and the role of for-profit healthcare. Sometimes people are ambivalent or think that it will relieve pressure or serve as kind of a release valve. There's lots of different, there's language that's used in terms of the role that it plays, and many talking about the same kind of, or using the same type of arguments that we often hear from government or from those that are advocating greater involvement of for-profit care. And so I think one of the, again, I'll make the pitch again for folks to check out the report. And I think a lot of the discussion around the myths around privatization and the role that it has in healthcare delivery, those myths are taken apart piece by piece in this report. I just checked the website. It's the second, if you go to policyalternatives.ca, it is on the main page. If you go to the publications, it's the second publication on the list on the main page. You don't even have to click anywhere. It's just right on the front page. And I think one of them that you often hear and that we hear again and again is that it relieves pressure on the public system and it reduces wait times. And again, I would go back to the experience in Alberta. Earlier this year, I also published a report with with the Parkland Institute at the University of Alberta. It's a sister research institute with the Canadian Centre for Policy Alternatives. And when I took the government's own numbers and assessed the success or the claims that government had made about this for-profit initiative called the Alberta Surgical Initiative, what we saw that as more funding and more surgical volumes were performed in those for-profit facilities, it resulted in a decline in surgical volumes in public hospitals. At the same time, we also saw a decline in public operating room staffing levels. And so this is, I think, to date, one of the most powerful examples. And it comes from, again, the government's own data. It took freedom of information. But what it shows is it really dismantles that argument that if you have increased for-profit involvement, you're somehow going to reduce wait times and magically things are going to get better. And quite to the contrary, the opposite happened. It increased wait times in the province. It pulled staffing from public hospitals into those private for-profit facilities. And overall, public hospitals, where the majority of surgeries are performed, were struggling to perform the surgical volumes that they needed to perform. And now Alberta is a province, along with Saskatchewan, that has the longest wait times in the country for orthopedic surgeries and other diagnostic imaging. So I think it's really important to be able to talk to the actual real world experience of how it's played out in places that have gone down this road. And then I would also say one of the arguments is that, we often hear the Premier saying Ontarians will never pay with their credit card, only with their OHIP card. So it's the fact that what they are pursuing is greater public funding for these for-profit facilities for OHIP covered procedures. But what we have seen in BC, which is a province where there has been a large for-profit sector that has been built up over many years, it's a province with officially the most unlawful extra billing in the country. And so what we have seen in BC, where I'm based, is it is a function of having a large for-profit industry where they, in addition to taking public contracts for publicly insured procedures, this industry has also been at the forefront of unlawful extra billing, contrary to provincial legislation and contrary to the Canada Health Act. So this is in table 10 of the report itself, but it looks at the experience. Again, these are official estimates that provinces provide to the federal government. So it is most certainly an undercount or a conservative estimate, but BC has had the most, so over the last 5 years, $83.3 million of unlawful charges to patients that are coming out of this for-profit industry. So when you hear those arguments that, oh, it's going to relieve pressure, it's at no cost to patients, that is not borne out by the experience that we've seen in other places, including BC. And then I think the final point is just around the argument around I should say the issue around provincial underfunding of public healthcare services and public hospitals. And I think this is a really important point because what we are seeing, and this was revealed through the CBC investigation, is these services these same procedures performed on a for-profit basis are much more expensive, and taxpayers and the public are paying a premium to have these same procedures delivered in for-profit investor-owned facilities. And those are dollars that are not going into public hospitals. And this, again, is similar to what we saw in Alberta. Those are dollars that are being diverted to investors and not public, not-for-profit facilities. And also in the report, what is very alarming to me, and I think is something that we need to continue to talk about, is the threat of two-tier healthcare and US-style healthcare is more real than ever. And if you look at Appendix C in the report, what it documents is there is growing interest from US investors in getting a piece of the action in Ontario and across the country as more provinces look to outsource procedures. Ontario being the biggest province with the most surgical and diagnostic volumes, this is the market that they have their eyes on. So once Ontario moves in this direction, you can be guaranteed that US private equity funds, US hospital chains, these are large investors that will want a piece of the action, and they are going to make themselves part of the healthcare system if they are allowed into the publicly funded healthcare system. So I think it's important that we talk about the fact that this is real, it's being documented, and organizations like the Ontario Health Coalition and all the local health coalitions are not going to stop raising this issue. As a researcher, I will continue to engage in this work, and it's going to take us continuing to push this forward and do the work that we continue to do to raise the profile, and as others have said, make the case that this is not unlike issues like the Greenbelt. These, it doesn't make any sense to be paying more than you would pay in public hospitals where we have underutilized capacity. So I'll just conclude there, but just to say it's really encouraging to be with you all and a real privilege to be joining you this evening. Thank you.
Thanks very much, Andrew. I think this is really important. The facts and the information that you've provided tonight, it's really going to help us to make the arguments that we need to make with the people around us, and also to help with our messaging about what's at stake with what's going on with Ford's policies right now. I'd like to ask Pam Parks to come and give us some final words as well. Go ahead, Pam.
Yes, I just wanted to say thank you for the participant and sharing your viewpoints. As a frontline worker myself, it does really truly warm my heart to see that over 300 participants tonight came on this call because of the healthcare crisis, and to listen and to hear. I'm not sure what the government or even our employer thinks sometimes, because you think that if you were just coming in, you would think we did not care for people, living people. And it's just that analogy that, you make one wrong move and someone will die, and people are dying and they don't care. They just don't care. And us frontline workers, we go into work because we care for people. I chose this profession because I thought I could make a difference, and that is why I went into nursing. And even though it is bad, really bad conditions that we're in right now, believe it or not, I still love the work I do. I do not like the policies and the working conditions that we're left working in. And I just want to say thanks to Alex for volunteering to put these pieces together, because I totally agree that unless the government and the employer sees these faces in front of them, that these are people that we're dealing with, they will not change their ways. And we have to get the stories out there. don't get me wrong, I don't want to see people in predicament and in pain, but if they are reduced to that because of the healthcare system and people are willing to share their stories, I think that will be the way that hopefully the government and our employer will take heed. We are actually looking after human beings and they need to care. And we are in healthcare and we cannot lose our healthcare system to privatization. And I just want to take this opportunity again to say thank you all for listening. And let's leave this discussion, but please join your local health coalition. If you don't already have one or you don't know who and where to find one, contact the Ontario Health Coalition and they will put you through to a coalition. But we as a coalition in Durham, we depend on volunteer. And please, if you can come out and help anywhere across where you are, come on out to your coalition and let's talk and look after our healthcare system. Thank you very much.
Fantastic, Pam. Thank you so much. And I think just to underline, I'm going to put a link in the chat. If you want to find your local health coalition, go to this link and you will be able to see, hopefully there's a coalition in your area. And please do join. It really makes a difference in our capacity to undertake more and more projects. We need all of us involved in this. So fantastic. Thank you. And I guess I'll hand it over now to Kevin Scarrett for some concluding remarks and responses to some of the questions. Go ahead, Kevin.
Yes, thank you, Michelle. And I will be quick with just a couple of quick last comments. I really appreciate Pam's, energetic appeal. I'm feeling a really good energy from tonight and all of the comments. I mean, I see there's a level of frustration with all of this grim news and this these disturbing reports. But the good news is, like, my feeling, I don't know if Natalie agrees, but my feeling is that this movement is actually growing in response to the seriousness of what we're seeing. So I'm very encouraged by tonight. I think we're really going to get somewhere. The one thing I would add as a final comment, I mean, I appreciated the sort of the funny question about, how is it that used car dealers are opening up health clinics? It's even a funnier question because, in fact, one of the dealerships that those two guys were running, it actually went bankrupt in early 2019, and 8 months later they opened a health clinic. So, I don't know how that works, but it does underline, I think, a point that Natalie and Andrew and others have been making about this dangerous, unregulated character to this whole sector. I mean, we just can't let these people take over in the way that our provincial government in Ontario seems to be facilitating right now. And I'll just close with this one piece that I just find really revealing and disturbing, but something that I think we can energize people around. I put in the chat a quote from a website from one of these Ottawa clinics. And I'll tell you, this quote just chilled my bones when I read it recently. What they're saying, they're advertising this new nurse practitioner service that they will be charging fees for. And they boast that this program is, quote, an affordable and private alternative to the public healthcare system. I mean, they're just coming out and saying it. We are building an alternative to the public healthcare system. It is bone chilling, but they are clumsy in not disguising that agenda. And this is something that I think we can use. And the more we educate and bring this out to people, I'm really confident that people are going to take the kinds of actions that we would all like to see to draw a line in the sand here and say, no more of this. We need to expand our public system. It will be more efficient and cheaper and more accessible and the kind of healthcare that people deserve. So I'll end with that.
Thank you very, very much, Kevin. That's fantastic. And just to remind people that in January, nobody knew what Bill 60 was. We organized a referendum in May. Natalie drove this thing through. We had 400,000 people vote in literally hand-to-hand I don't want to say combat, but it was literally getting people organized. 400,000 people, 99% opposing privatization. That's the kind of work we need to keep doing. We did a mass demonstration September 25th at Queen's Park, 10,000 or more, and so we'll need to keep doing that. And so the passion that people are expressing here is absolutely vital to taking this forward. So Natalie, if you want to bring it home and wrap up our evening tonight and give us some words of where we should take this.
Okay. Thank you. Thanks so much to all the local health coalitions. I think you can hear there's a real social movement out there in Ontario, you know, and it is local health coalitions across the province. Some are stronger than others, some are larger than others, some do more community organizing than others. And what we're trying to drive is that all of the local coalitions will do more and deeper community organizing, education, and then that visible resistance that shows people that there's a fight back, that provides them a way to join in and something concrete to do that has some chance of being effective. That's our job. You know, it's our job to figure out what that is and to do it. A lot of you, I just have very quick answers to people's sort of general questions here. A lot of people talked about messaging and how important the messaging is and so on. I agree. However, for 27 years now, we've done polling in the various health coalitions at various different times. The truth is that every argument works, and they all work within a very small degree of each other. So the conflicts of interest work, the taking staff out of the public hospitals, and you know, all of that, the extra costs and violating the Canada Health Act, the quality issues, all of those things work. The issue is how to get them out to regular people. For those people who are frustrated that there are 300 and, you know, whatever it was, 40 people on the line today, it's a public forum. People come to a public forum, but it's from these public fora where people take information back out to their communities. And the next step that we're planning, and so Alex and Alexandra and all of you who are offering help, you're wanted, we're planning to do a leaflet like we did in the referendum, where we got out somewhere between 1 million and 1.5 million leaflets, which is amazing. It's a province of 15.8 million people. Let's say there might be 5 million households or something in Ontario. So that's an amazing feat. Most organizations are not able to do that. That was all of you on street corners and going door to door and so on and so forth. Next, we want to try and reach 2 million people with one leaflet against for government privatizing our public health care. And so we'll consult with those of you who volunteered on that. We're consulting with the local coalitions and our board, and we'll develop that. And starting in January, running through till April, we'll do that. That's the organize and educate. I was thinking as people were talking about the stories and putting an individual face to it, and all that work that we've been doing on long-term care for so many years. And how, I mean, it's just heartbreaking. There's two things coming on that. One is that I'm applying for a grant for us to do a memorial for the people that died in long-term care. And so there'll be, you know, I hope, a standing memorial for that. And the second is that we have a plan to do an updated report on long-term care. And people, Joseph, you were talking about was it Joseph? Ford's promise. Oh no, the lawsuits. They're going forward in February. They've gone to case management. And sorry to the person who was talking about, oh, I lost it here, but Ford's promises on long-term care, like they didn't, you know, they brought back in inspections, but they're lesser inspections, and a whole lot of things they promised didn't happen. So new report early in the new year on long-term care with the families. So that will come forward as well. But all of those people talking about the individual stories, Ghost Gurney has been doing this on TikTok and on Twitter. It's so good. Could we work with all the local coalitions? Could we get those individual stories? They need to be tied back to an analysis of the issue, and they need to be short, super short. But so we could just flood social media with them. I think that's something that we could easily do in our movement. And so maybe that's something we could kind of work on. sorry, the Integrity Commissioner and the Auditor General, Malcolm, and the others who proposed that, absolutely yes, particularly on the private clinics being paid more, on Don Mills Surgical and all of that stuff. So we're all thinking along the same lines for that. I've been working with Democracy Watch, and we are putting a complaint forward to both the Integrity Commissioner and the Auditor General on that one. For Tana and for Terry, sorry, I'm trying to go quickly. I just wanted to say I'm really sorry for what you personally have gone through and your families. And our commitment is that we'll do everything we can, everything we can to improve things so others don't have to go through that, and also to help you in those certain situations. When you're talking about waste, that kind of feedback from the public should be something that is listened to somewhere. We need to fight for democracy in the public health system. Like, public means public. That means restored publicly elected boards. And I'm looking at Hugh Armstrong, who was on a publicly elected CCAC board when home care was once democratic, and that board was able to expose that when the Harris government forced them to privatize home care, it cost vastly more to so it was physiotherapy, I think, and rehab in home care. It cost them vastly more. We need to re-democratize healthcare, and leading into the next election, we should be pushing all of the parties for platforms that are not just the status quo, but a much improved, really public healthcare system that listens to those sorts of things. So I think the other ideas that I had when you were here, in long-term care, we filled the galleries at Queen's Park virtually. I think we could do that somewhere between January and May. We could fill the galleries in person and virtually, and have kind of a healthcare day where we get all the opposition parties to bring forward those individual patient stories. I need your patient stories about being extra billed. I need them ASAP, because we're putting out that report. So anyone who has those, I need them. I need people who will speak to the media who are patients. Please help with that. So we can fill the galleries like we did on long-term care. We can do a series of patient-led press conferences across the province also in those months of January to April. In May, mass protest at Queen's Park, possibly preceded by local or regional large protests. So we have to have that visible resistance. People have to see that there's a fight back and a way to join. And then out of that, we can put onto the buses lawn signs that people can take back to their communities, and we can cover the province in lawn signs. And if we had 320 people here today, if everyone knows 5 people who they can talk into helping, we've got a small army of people to then get more people and spread this out across the province. We can do it because we did the referendum. We can make it even bigger this year. And ultimately, the Ford government is, as Kevin, noted, ultimately, they're going to have to back down from this. And so, well, I like the comments about messaging. Don't forget, as Bob White used to say, sometimes it's not the strength of the argument that counts, but the strength behind the argument. And that literally is every one of us. Thanks.
Fantastic, fantastic, Natalie. How are people feeling about that program? I think it's been a really inspiring evening, and also, sobering in many respects. And we know what the fight is that we're up against. So for all the people who are here tonight, if those of you who are plugged into a local coalition, keep it up, keep going, take a break when you need it. But we're going to need to, this is a long haul. And if you're not involved yet and would like to get involved, coalitions meet at varying frequencies. I'll put the link in again for you to go and look in your region. For those of you from the Greater Toronto Health Coalition, don't forget we meet in 2 weeks on Tuesdays at 6:30, every other Tuesday. And this meeting has been recorded, and so once it's up on the networks, please do share it with people who you think would be interested in hearing about what is going on here in Ontario. People are inspired about what happened around the Greenbelt. We know there's always, it's not over till it's over, but it was a fantastic movement from the grassroots. That is what we're doing. We're up against a very, very big opponent, but the pressure that we're bringing to bear in the localities, at the MPP's offices, and in all the ways that we've been doing is vitally important, and critically reaching people and letting them know we don't have to accept this. We can fight back against this. We've fought back against it before, and we've won before when they've tried to do these, these wretched things. They've been doing it since Tommy Douglas, since the beginning of Medicare. So let's get our energy up. We're heading into a little quieter time in December, but that doesn't mean we stop organizing. And someone mentioned in the chat, perhaps a leaflet that could go out to your family for the holidays, just reminding them how precious our public health care is and how we've got to fight to keep it. Thanks very much to all the participants, to our speakers, and to everyone who's come out tonight. It's really vital that we keep doing this.